my two dogs. This is Hawk, and this is Amber. And about 2 weeks ago, Amber was diagnosed with diabetes. And that's been a big change for our family. So diabetes can happen in dogs for many different reasons. Some can be overweight, which is not the issue with Amber. Some are genetics, age, gender, and other things like that. Amber had a back injury and we took him into the vet to get that checked out. And during the blood work, came back with that he had diabetes. So we are now trying to figure out how to handle this as our family and sharing it with all of you and you guys too, if you guys ever need that. One part of diabetes is tracking the blood sugar levels. And so Camber has a sensor that's glued onto his side, and it lasts for 14 days. And we try to check it every couple hours throughout his day to track his levels. We have an app on the phone called Freestyle Libre Link, which links to the sensor. And all we do is from the back of the phone, put it over, it vibrates once, it vibrates again, and it gives an indicator of what the glucose level is. One part of treating a diabetic dog is having consistent food. So Camber needs to eat every 12 hours. So right now we're shooting for 9 and 9. There's also specific food that he is supposed to eat. We are currently trying Hill's prescription diet. He's really only eating the wet food and human food right now. So we are using lean ground turkey and brown rice, and then mixing in some of the canned food to make sure that he gets all of his nutritional benefits, but is also getting food, regular food. One of the biggest pieces, as mentioned, was making sure that Camber eats. Camber is eating right now, but sometimes he gets rather picky. So we've thought of lots of different ways to ensure he gets food into him. And really, the vet has told us that as long as we are getting consistent food into him, right now that's the biggest concern. So please talk to your vet about any food and treatment. This is just our experience with Camber. A major part of treating your diabetic dog is giving insulin injections. So we have this really handy box that came with the injection needles, and it's also a safety dispenser to safely discard them. Okay. So with this insulin, we shake it first. Then you remove the white and the red. The needle has numbers along the side, and I pull it back to the 3. So I go back to 5, and then I make sure it's at the 3 with air. Make sure that's shaken, turned upside down, and inserted into the center circle. The air is then pushed into the bottle. It is then pulled back to the 10. Make sure that all the bubbles are out. And right now Camber is getting 8 units, so I go back up to the 8 and then remove from the bottle. I then put the insulin back into the front. When given the insulin, you're working around this area of the dog, right at their hips where there's some extra skin. You're working on getting a pinch together that makes an A flap. You want to make sure to rotate where it's at. So yes, for this morning we did the other side, so this time we'll do this side. An A, push the needle in, and then slowly push in the insulin. After feeding and giving insulin, we scan one more time just so that we can track the data, because it goes directly to the vet so she can track and see how he's doing and adjust his medical plan. So once it's scanned, I can add note and click food and insulin. That way my vet knows exactly when he ate and got his insulin. Please remember, this is just how we are handling Camber's diabetic treatment, and please consult a vet for any information on your own pet. Thank you for watching.